So this video is going to be about speech pathology and how a speech pathologist treats primary progressive aphasia, or PPA. And I'm going to talk to you a little bit about what exactly we do in therapy with someone who has PPA. And I'm going to give you some insight into a treatment method that you've maybe never heard of that can be really beneficial for PPA. So PPA, or primary progressive aphasia, is typically diagnosed by a neurologist, and then the neurologist will send a referral for speech therapy to a local clinic or private practice. But you don't actually have to have a referral from your neurologist. You can seek out a referral from your primary doctor, or just call your local speech language pathologist and ask them what the referral process is. So you don't need a doctor to bring it up first. If you are interested, or if you are interested in a family member getting therapy, you can go ahead and reach out to the speech pathologist yourself. So what is the main purpose of speech therapy when working with someone who has PPA? So it's trying to delay the decline, or possibly even improving, at least temporarily, one's language and cognitive abilities. So next, I would like to explain a little bit about the therapy approaches that we use as speech pathologists, because people often perceive therapy as purely rehab, which is where you work on a deficit until it's fixed. And there's other therapy approaches that we use that are just as important, if not more appropriate and impactful for this population working with PPA. And one of these approaches you've maybe never even heard of or thought of, and it can be really life-changing for someone with PPA and for their families and friends. So that is an aided language or aided therapy approach with an alternative and augmentative communication device. So I'll say that again. It's an aided therapy approach, and we're using an alternative and augmentative communication device. And the acronym for that is AAC. So you're probably familiar with one of the most infamous, speech generating devices, or AAC devices. And that is, I think of, Stephen Hawking, who uses a speech generating device to communicate. So AAC can be low tech, like pictures on a picture board. However, that can get kind of cumbersome to print off and laminate pictures for someone. But AAC can also be high tech. So that's using something like a speech generating device that's nice and durable. Many insurances cover this as long as it's medically necessary. And then there's also AAC apps that you can buy out of pocket on your personal iPad or tablet at home as well. So an AAC device, or a speech generating device, has several images or icons on it that someone can press, and then the device speaks for them. And there's lots of different layouts and softwares. Some softwares have smaller icons. You can get softwares with bigger icons, all different page sets. And that's why you need a speech pathologist with experience in AAC to assess the individual and make sure they really understand their strengths and what they are going to need in a device.